speaking with Ms. Gabriela Cuevas, the president of the Inter-Parliamentary Union, and she's based in Mexico City. We have a couple of questions for her about the IPU, and I'm really interested to hear her thoughts at this time during the COVID crisis. So Gabriela, what's your advice to parliamentarians in the time of COVID-19? How can they best facilitate the emergency health measures recommended by the WHO?
I think one of our most important responsibilities has to do with our own role as parliamentarians. It means legislation, it means budget allocation, it means oversight. And in this specific emergency, it makes even more sense. For example, it is very important that we prepare legislation to protect health workers. In many countries, they are not protected, neither their families. Also, it is very important that we can make legislation to allow the government to act. In some cases, some of the reports that we have been receiving from parliaments, they are just improving their legislation. I think that we never imagined something like this coming. So it is very important that we prepare legislation for a calm time, but also for the time on emergency and taking into account all different factors. One of the most important things, I believe, is the implementation of the universal health coverage. We're always speaking about this as a human right, but when it comes to reality, it is forgotten. So we need to prepare our law to have a comprehensive system, but also to translate this into budget. The other very important responsibility is how to use platforms as IPU, as United Nations, as WHO, for international cooperation. I believe that what has been missing a little bit during, especially the first months of this emergency, has been international cooperation, exchanging information, exchanging best practices, how we can help each other. I think that we are not learning from other countries' experiences, and that is going to be a mistake at the end of the time. So as parliamentarians, as an international organization, we can be that very important platform, and we need to be prepared now, but also for future different emergencies.
Okay, yeah, all very practical advice, and especially with universal healthcare and sharing the learnings and what's being scaled up and developed throughout the world. The next question is, how can parliaments still function, debate, pass legislation, scrutinize governments? Are there countries who are getting it right, from your opinion, and what you're seeing, and that other countries can learn from?
Well, this is literally a work in progress, because again, no one was expecting to have this kind of circumstances. Some of the countries, especially, for example, the Europeans, they are saying we never saw this kind of circumstances from the Second World War. So we are prepared for a regular situation, for a regular parliament, but we are not prepared for an emergency. So most of the countries are now changing their own internal regulation in terms to be prepared, for example, for having long distance meetings with having technology and different tools in order to not stopping the parliament, but also to be in accordance with the health measures. So that's important. Some others are respecting the distance between persons, but they are still going to the parliament. So there are different practices. I believe that we need to learn from this situation. First of all, in terms, yes, in preparing our own internal law as parliament, but also this is an opportunity to use technology to make parliaments closer to people. In these emergencies, it is very important that people know that we are working for them. And sometimes we forget that. So using these kind of tools is easier, for example, to have practices on open parliament, on bigger transparency, even to have a more interactive relationship with our constituencies. And of course, also to be part of the solution. Some of the parliaments are also changing their budgets in terms to give to the government all the tools that they are going to need for the hospitals, for infrastructure, for medicines, etc. Some others are already preparing an economic package, because we all know that we are also going to start an economic emergency. So they are going to these two very important issues, and I believe that we need to continue working on this regard.
Okay, great. Yeah, the idea of bringing Parliament closer to the people is really great, and that continuing that communication dialogue, and even planning ahead 2 weeks, right? Because you can kind of see what's coming. The next question is, how are women contributing to this global health emergency from what you're seeing, and what's the impact of coronavirus on the lives of women?
Well, I think that we usually believe that women are going to be staying at home, taking care of children during an emergency, but women are at the front line. They are nurses, they are doctors, they are policewomen, they are at the army, they are going every day to the very front line, and they are risking their lives, and they are, in many cases, leaving aside their own families. The difficult part is that women are not being recognized from this very important responsibility that is, again, I insist, they are risking their lives. If we go, especially in the Asian women, to developing countries, we can see that they are even more forgotten. They are not just seeing as the doctors, as the women at the army, at the police. They are saying like, okay, the nurses that we do not need to consider. For example, I was just reading yesterday a terrible news that in a small community, the public transportation was not allowing nurses to go into the bus because they thought they were going to be infected instead of thanking them. So I believe that we need to recover, first of all, the responsibility that we're facing as women. We have a lot of different responsibilities as daughters, as mothers, as colleagues at work, but there are a lot of women that are risking their lives, but they are not going to the upper levels. They are not into the decision-making process. So we need to be more inclusive. When we talk about health, we need to have women's approach, because not only because we're half of the total world's population, but because we have a very special sensibility for what's going on for children, for adolescents, for all, for girls. So I believe that we need to take also this lesson from this important emergency. Women and girls need to be considered, and women need to be thanked.
Okay, yeah, thank you for that. You know, a lot of organizations are readjusting, realigning now that this global pandemic has hit. What were the goals of IPU at the beginning of 2020, and how have those changed in the last few weeks? And maybe even specifically goals as they relate to different contexts, you know, different countries and developed world, developing countries, all that.
Well, we had a plan. I think like all organizations, national, international, regional, we had a plan. We had a calendar, we had events, we had an idea on seminars, assemblies, workshops. We had a lot of projects regarding health, for example. But of course, everything is changing. And I believe that we need also to adapt. It's not easy. I think that this emergency started with a very nationalistic message. And it was seen as a national problem. It started with China, then it went to Europe, but it was, I think, at the beginning, another country's problem. We took a lot of time. I think that we had that mistake as multilateral organizations. We took a lot of time to ask the countries to exchange information, to exchange best practices, to exchange what they are learning from each patient. And I believe that's something that we need to understand and to do even now, because apparently this pandemic is just starting to move to developing countries. So we are still on time, perhaps yes, a little bit late, but we are still on time. The other very important issue, I believe, is that we need more international cooperation. We need to understand that no country is going to find a solution alone. It is not like I am going to have a vaccine for me and for my people because I am going to an election. It is not like I am going to see which is the medicine that my people need because I want to be popular and to have all the market for that medicine. We need to go further. We need to understand that this virus is not respecting borders, and it is not going to respect a nationalistic policy. We need to understand that the only way to solve this is as humanity, as a world decision.
Okay, yeah, thank you so much. It's that the national policies and what that means for a virus that doesn't, you know, respect that is really provocative and poignant right now. Thank you so much for joining us, and I think that's all. Unless there's anything else you want to say.
No, thank you. Thank you very much. It's always a pleasure to work with you. Thank you very much for taking care of women, girls, and children. Thank you.